Cool. This meeting is being recorded. Oops, I got to hit OK, huh? Thank you, Ivan. Okay, I guess I can get into this now since it's 11:45. All right. As you can tell from our little buddies here, this is our brain working out, pumping iron. So basics of brain health. This is really basic. This is really just barely touching on the subject, but I'm going to look at, what they and how do we maintain, what are they? I guess I need to speak to the person who does the editing. Yeah, what are the basics and how do we maintain? Uh, Again, I need to speak to the person who edits this because this looks a little awkward. But we're talking about brain maintenance. How do we maintain that? All right, so what are the experts saying about brain health? Well, okay, from a couple of different sources. Trust me, there were plenty of sources I could have cited here. It would have taken several slides. But American Stroke and Heart Association, they describe it as optimal brain health being, average performance levels among people of specific age who are free from known brain or other organ systems diseases. So in other words, brain will be able to be optimal, provided there's no cancers, there's no dementias, etc. So, when we talk about disease, we're talking also decline in function and ability to perform desired activities. When we talk about system failures, because the neurological system is the brain and spinal cord, the biggest central nervous system, peripheral nervous system. So that's the American Heart and Stroke Association chiming in. Now, the Centers for Disease Control and Prevention defines brain health as the ability to perform all mental processes of cognition, including learning, judgment, language, okay? And so good brain health goes beyond the absence of disease, which is kind of what American Heart and Stroke Association are kind of looking at. We're talking about the brain performing optimally. It encompasses all cognitive functioning, resilience. Can the brain find new pathways to communicate and still function optimally? And of course, all of that is about a state of well-being as well. So, wow, why is the brain so important? Well, if you looked at the basics of brain anatomy, and this is very basic, and we're only really looking at the outside, the features you can see if you were looking right at it. Each one of the lobes has different things going on in them, and they're also in charge of different things as well. It's amazing. And it's because of the neurological network that makes it amazing that one part of the brain can communicate with another part of the brain, and one half of the brain or one hemisphere can communicate with the other hemisphere because of a network of white matter that called the corpus callosum that's in between the two hemispheres. And I won't go into detail about that, but with good communication there, and you have the network of the white matter, because the gray matter is located in the cortex, while the white matter is a little bit longer, and it assists greatly in communication. And actually, in women, without going into detail, they have more white matter than men do. That's why both hemispheres of the brain communicate better in women than they do in men. Okay, so a lot of different functions, a lot of different things going on. And of course, I do want to mention the spinal cord because that's where signals ascend and descend to the rest of the body. or either from or to, pardon me. So here's a little bit more detail. If you were to cut the brain in half and we're looking at the inside of one of the hemispheres, we're looking at some of the midbrain structures, even the deeper structures like the hypothalamus and where the pituitary gland is located, and what these deeper structures do. So I thought this was a pretty cool slide. I got it from a website, How It Works. You can see it, how it works. So this is a brain map. And so, again, you can't see these if you're just looking at the structures from the outside, but if you remove it and look deeper, these areas of the brain have vital functioning. If we're talking about the pons, medulla, midbrain, vital functions there, or actually part of the brainstem, the cerebellum with balance, and some of these other deeper structures are involved in memory, especially the cerebrum. Again, that's a bigger, I want to say the largest part of the brain is the cerebrum, and it's covered by it is the cerebral cortex, or covered by the cortex. And memory is a big thing that happens there. That's why so many of us maybe are worried about things like dementia or mild cognitive impairment, and how sometimes that becomes a progressive thing over time. You notice it, and then all of a sudden, over time, your impairment gets worse and worse and worse. And that's usually with your dementias like Alzheimer's. So brain and neurons, quickly, I covered some of this. So the brain has an outermost cover called the cortex, and it's about 1.5 to 3 millimeters thick. It's full of neurons, the gray matter, full of neurons. And that is actually, the neuron bodies are located in the gray matter, whereas the axons make up your white matter. So covers all the cerebral hemispheres. And the neurons are the principal, if we put it down to the nitty-gritty, the neuron is the principal communicator in the central nervous system and the peripheral nervous system. And as I mentioned maybe before, the cortex is very dense with cell bodies, but the density is thick throughout the central nervous system. And that includes the deeper structures of the brain that I alluded to with that one slide. So, and as I just touched on, different regions and structures of the brain have specialized purposes. All right. Actions within the brain help to create memory, to think critically, and to create our senses, audio, visual, sensation, hormonal activation, neurotransmitters, everything. So it's not just about thinking, it's not just about memory. There's quite a few other things that occur. So it's got a big job. So you'll have to excuse my handwriting. I really did the best I could with some of this, but I realized that my writing, I think this was in Word, and it just doesn't look good, but this is describes certain patterns in the aging process from a healthy young adult, which has, you may or may not be able to see the legend up here. Red is related to poor cognition. So when you see the red arrows, we're talking about poor cognition. When you see the green, we're talking about maintaining cognition, okay? And the arrow up means activation. The arrow down usually means some sort of suppression in that area of the brain. So if we look to the brain maintenance slide there, or the brain maintenance shot, no changes in brain activity and cognition. So everything remains intact and in balance. However, in some states of aging, because we're all going to encounter that, there's some neurocompensation that has to occur. And so what it's saying is your brain is able to activate new pathways of communication, in essence. That's what it's alluding to in my poor handwriting there in purple and blue. Now, if we're going to get into more cognitive behavioral changes in the brain, then we're talking about some neural insufficiencies as we're moving from green to red, which means there is less suppression of brain activity and cognitive decline. But on the other hand, there's an increase in poor cognition. That's usually caused by some sort of damage to the brain, illness, could be cancer, could be Alzheimer's disease related tangles within the brain that in effect deactivate your neurons more or less by strangling them. So then we move to the far side where you have red arrows up and down. So you have a lot of loss of neural differentiation and distinctiveness, unorganized activation, suppression of the brain as far as regions communicating, networks, and you have severe cognitive decline. Well, some of that may happen naturally. Some of it is, well, enhanced by disease. So they have my red handwriting. Even in healthy aging, there are some patterns of this loss of neural distinctiveness and differentiation. That's really the bottom line. And they're able to detect this using a special MRI called functional MRI. And they can also use PET scanning to visualize this too. They can see where blood supply is going, areas that, maybe blood isn't able to get to that part of the brain for some reason. They can pick up on neural activity that shows up as different colors within the brain, which is kind of cool. So that can be picked up with certain forms of MRI or PET scanning. So here's our aging brain. You have a healthy 25-year-old on one side, and then we go to an 80-year-old who has some cognitive losses. A normal brain of a 25-year-old, everything looks balanced and even. Now you go over to the other side, and you can see there's been a loss of brain matter. There's an enlarging of certain areas called ventricles within the brain, and it looks like the certain folds, inward folds, are broadened, which under normal circumstances they shouldn't be. This is an individual with very distinctive cognitive losses. So again, this is the slide on the other side talks about some of the things I just described, like smaller ventricles, say in the 20-year-old brain, and the grooves, the sulci, there's a big difference in gaps and how close everything is with those dips and rises on the surface of the brain. But with someone who has cognitive issues, the brain of a 90-year-old, I don't want to say all 90-year-olds have lost cognition that severe. Some have, some 80-year-olds, some 70-year-olds. But you can see from the picture that the ventricles have maybe 1.5 to double in size. And the sulci, those fissures, are deeper. And I want to say there's a loss of certain brain tissue when that occurs. And you can see on the other slide that there's obvious signs of, I want to say, brain tissue loss due to whatever is going on there, which might be Alzheimer's, it might be some other disease or illness affecting the brain. So, okay. The following slides are going to cover the quick basics of brain health. I'm thinking, I hope it's quick. So, what can we, how do I get rid of that, Ivan? I got that. How do I move that? Can I move that? Or shrink it? Can I shrink it? Oh, okay. Well, maybe I didn't. Oh, there we go. Thank you, Ivan. You are the tech. You are the tech. So what can we do? What are things that we can do? Well, all right, there are some points. Exercise on a regular basis, eat a healthy diet. When I was looking for different diets, they seemed to hone in on the Mediterranean diet. What about alcohol? What does the research say about the brain and alcohol? A big deal is staying socially active and engaged. Okay, so what does that entail? Get plenty of sleep. And I'll tell you why. Getting the right amount of sleep, whatever that is, if it's a little more, maybe a little less, your brain needs time to download and secure memory from the day and secure that into long-term memory, as well as, dipping into short-term to place it into some permanent memory bank. But your brain also has a way of flushing out toxins. It's kind of toxins. Well, things like the beta amyloid, which is behind illnesses like Alzheimer's, dementia. That's a big deal. And if you get the right amount of sleep, you can keep the brain flushed and clear of a lot of these toxins. I never realized until looking into this a little more how important sleep is. When I started teaching with Professor Malarkey downstairs, a nursing course in brain and gender differences, I started to take a deep dive into sleep because I have problems with it. I have apnea and I have to use a machine, but it is a wonder what getting the right amount of sleep means to the brain. Engage in activities maybe you've never done, or activities that are challenging, within reason, of course. And playing it safe, which is akin to like wearing a helmet while cycling or, bicycling, or if you like to go on a motorcycle. So it doesn't necessarily mean that that's what you're doing, is putting on physical armor or whatever. It could mean other things too, like how much should I exercise? What kinds of exercises should I do? And maybe what kind should I avoid? So exercising on a regular basis and healthy dining. So the CDC says about 2.5 hours or 150 minutes of moderately intense physical exercise activity. And that includes a couple of days of weights and muscle strengthening to mix in there. You can mix that in there for sure and get lots of benefit from that, because that contributes to overall structural health and reaction time, etc., and help to keep bones stronger if you're working them out. Exercise is very useful, of course, for cardiovascular health and blood sugar control. Okay, so and for a long time now, for at least 45 years, we've known that exercise plays a part in helping to control anxiety and depression. So that's a biggie. And so that's not necessarily a new thing, but it is something they've been researching for that long. So it plays a part in that, which is good. It's a positive. So what kinds of foods or what kinds of diets? Good Lord, you could go to one of those books and pick out, all kinds of diets that are beneficial. So it's kind of like, why did I focus on Mediterranean? Well, because that one seemed to be the one that was brought up the most when paging through, one website to another, to another, to another. So that includes high portions of fruits and veggies. It includes breads and grains. So in addition to that, that would include nuts, beans, seeds, and potatoes. All that sounds very healthy, and all that sounds very familiar to other diets that include, major plant-based, right? Olive oil in a Mediterranean diet is considered the primary fat source. Eggs and fish are acceptable. Some dairy products in moderation, also acceptable. Fish and poultry, they added, are more common constituents when it comes to meat sources, protein sources, good protein sources, not that beans and others in the plant family aren't, they are. But fish and poultry tend to be healthier than, say, red meats, porks, beefs, and things like that. Any questions so far? No, we're good. Okay. Feel free to stop me at any time if I've left something out or if it doesn't sound right. So feel free to chime in. Yeah.
Can you sleep too much?
Ah, okay. The question is, can we sleep too much? Well, in certain states of mind, like depression or anxiety, it could contribute to sleeping too much, as can some medications contribute to sleeping too much. And in that sense, that can be a negative thing. Yes, it can be. Because maybe you're sleeping beyond the point where your body, needs to. So there's sleeping too little with obvious effects, and there's probably sleeping too much with obvious effects. So, generally they go along with 8 to 10 hours or 7 to 9 hours, somewhere in that ballpark. And I'll get to that. That's a good question, by the way. So what about alcohol? This is in huge dispute. Most of the information I've seen on alcohol has to do with the abuse of alcohol and how it is a factor in making so many illnesses worse and also creating illnesses as well. So it exacerbates certain conditions like hypertension. It can make osteoporosis a lot worse. Diabetes, it has a direct effect on that. It contributes to an uptick in strokes, CVAs, and what I've seen is a lot of people who abuse alcohol, they end up with cirrhosis of the liver, or they end up with, ulcers of the stomach or intestines. And so it's a big contributor to starting illness if it isn't, making certain illnesses that you may already have a lot worse. But so now these are from studies regarding abuse of alcohol. And boy, abuse can be, that has a wide range too. It can be moderate to, way, way, way too much is too much alcohol. Some studies appear to say that even one drink is detrimental. However, on the other side of that study coin, some are saying and actually providing data to prove that there is a slight benefit to one drink a day or very mild or light drinking of alcohol. I'll show you a slide here. We're coming to it that seems to show some conflicting, or what I should say, mixed results regarding alcohol. So I'd say many questions remain regarding the intake of alcohol. If you don't drink, don't start. That's the best advice I can give. But as to the benefits or debits, there's still a conversation going on about that between experts. I wonder how much the alcohol industry is backing, the intake of alcohol. But on the other hand, in Europe, they don't seem to have as much problem with alcohol because it's already been incorporated into, for instance, the Mediterranean diet. Just has been for a long time. And it's a question here I wanted to give you to think about. Is it realistic to advise someone who drinks to drink a zero amount, which means stop drinking? Or I think it's realistic to somebody who doesn't drink, don't start. Because you don't have a history of drinking even a little bit, so why would you start? I mean, it is a good question to ask. I thought I'd throw that out there. Now, this is the slide that has the pros and cons. So to decide for yourself, what does alcohol do to your diet? This is where you get conflicting information depending on where the data comes from and depending on who's sponsoring this data. Some say there's benefits to it, a little, a mild amount. However, on the other hand, too much alcohol can lead to a lot of weight gain. That's one of the debits to alcohol, especially if you think about beer. Yeah, bottom line, you don't have to cut it out completely, but I imagine you have to have a lot of discipline to keep it to a minimum. So I imagine it's what kind of individual you are that you can do such a thing, because human beings have a way of doing things in excess. I'll just leave it at that. But the other slide here, moderate beer consumption reduces the risk of 30 to 35% of heart disease. And I'm wondering, where in the world did they get that information? Moderate beer consumption reduces the risk of type 2 diabetes by 30%. So I'm wondering, what's the source of this data that they put out here? Beer can reduce the risk of kidney stones by 40%. This is an extreme view of alcohol, especially we're talking about beer, so a certain kind of alcohol. So I thought I'd throw that in there for you to think about. So let's move to social. How do we stay socially connected? How do we, engage? How do we keep on being socially engaged throughout the lifespan, Well, studies have found that being socially engaged all throughout the lifespan and absorbing new activities as well with that plays a role in maintaining cognitive function, normal cognitive function, even in late adulthood and even in possibly delaying or preventing certain kinds of dementia. So on the opposite, or I should say on the flip side of that coin, staying socially unengaged, isolation, loneliness, poses a big health risk. It poses a health risk on maybe at the same level as something like obesity and smoking. Because the risks of being lonely include things like depression, anxiety, suicidal ideation, and other chronic health issues. Because if you're isolated, lonely, you're not moving, you're not getting out, you're not engaging your brain in activities, you're not trying new things, you're more likely to be depressed by yourself and maybe even pick up habits you didn't have before that are detrimental. So this is where that pumping iron of the brain, our little brain character at the beginning, interacting with others is like exercising the brain, shown to enhance cognitive flexibility. And that's what we want to keep going throughout the lifespan. How are we doing so far? We making sense of this? I hope. For me, because I was a neurology nurse for 23 years, I often wonder, why did I stay there? Because I always get that question. Oh, neurology, you poor thing. You know, it's dealing with strokes, brain injuries all day long. I thought, well, I enjoyed that, actually. I enjoyed seeing changes, and I did see Alzheimer's, dementia, Parkinson's disease, Lewy body syndrome, everything. But I still enjoyed that area of nursing, and I stayed there throughout, you know, my active years as an acute care nurse. Anyway, so the fact that interacting enhances cognitive flexibility is a darn good thing. So why is sleep important? So where do you begin with this? Because this reaches into individuals that have all kinds of sleep disorders, from insomnia to apnea to other even worse sleep disorders. So why it's important, because a lot of people, um, well, here, 50 million people suffer from some kind of sleep disorder, whether they can't sleep, they can't maintain sleep, or, you know, they visibly stop breathing because of apnea, whether it's a centralized apnea or if it's a physical apnea where the tongue just lolls back and closes the airway. So it's important, very important, because in the end, with apnea, you're cutting off oxygen to the brain. That's a big deal. Other areas of the body too, but importantly to the brain. So correlations have been made between poor sleep and incidence of neurologic disease. Cognitive aging is part of that neurological disease. So Parkinson's makes a big contribution, so do strokes. It's part of that. Hypertension, Alzheimer's. There's so many illnesses that come from a lack of sleep, whether it's I can't get to sleep or, oh my God, when I sleep, I nearly die. That kind of thing. So sleep interruption has been associated with the buildup of this beta amyloid, this protein, usually associated with certain kinds of dementia, especially Alzheimer's. So poor sleep hygiene doesn't allow your brain to reset and to deal with built up toxins, you know, over time. So that's where the connection is. So good sleep quality is associated with this flushing process I just mentioned. Cleans out toxins. Associated with long-term storage of memory, like moving memory from the areas that are short-term and create memory to another area of the brain that actually stores it and keeps it. And involved in consolidation of memory as well. And capacity for new learning. Because it's like, hey, you can't teach an old dog new tricks. Of course you can. That used to be an old saying. But yes, this aspect of sleep and the importance of it helps us with the capacity for new learning. All right. Now, oh, I wish these slides were a little larger, because you really can't read what's going on, how sleep impacts your brain and sleep and aging, because there are changes in the amounts of sleep and quality of sleep with aging. And so there are going to be some noticeable effects, but as long as you can get them under control, they won't be, you know, hugely damaging. Well, so when you think about it, sleep contributes to more efficient and clear thought processes. And I'm looking at the blue slide. Keeps your mobility healthy, because when you think about it, if you're fuzzy in the brain and maybe you're a little ataxic or a little walking around drunken in a way, that doesn't that does not promote your keeping your body healthy, because it makes you exposed now to falls and other things going on if your equilibrium is upset. Now, sleep also has an impact on your appetite. And usually people who have poor sleeping, it usually makes them overeat. And they're taking in more and more and more calories. Now, if you have good sleep, it clears out those harmful toxins I talked about. And getting back to the appetite thing, if you sleep well and get a certain amount of good quality sleep, it's not going to have a big impact on your diet and how much you take in the way of calories. But good sleep also, on the positive side, helps you organize new things that are happening in your life, whether it's, day-to-day things or something at your job. So it has a positive impact. But on the flip side of that is a negative impact. Maybe it disrupts your organization of, thoughts and how you're going to proceed with things in daily life. So I could read over the rest of this. It's on the slide, but you can see there are debits that go with poor sleep hygiene. There are going to be some obvious debits. I'll just mention this quickly, before I got diagnosed with sleep apnea, I'd wake up with a headache in the middle of the night. I wake myself up from a snoring binge, and I'd be gasping for air. And, I woke up with brain fuzziness. So my answer to that initially was more caffeine. And one night my wife recorded my sleep. And she played it back for me the next morning. Listen to this. This is your breathing while you're sleeping. And there were obvious gaps where I wasn't taking a breath at all. And when I finally had that sleep study done, they interrupted my sleep in the middle of the night about 12:30 and said, "We got to put this on you, Mr. Mitchell. Your oxygenation, SpO2 went down to 84%, and it was falling from there." And so I didn't realize how bad or how poor my oxygenation was. But now I understand from a certain standpoint that that's why I was getting all the headaches. Poor oxygenation. So yeah, it's too bad I didn't find out about my own apnea or discover that earlier. So engage in new activities, challenging activities. And this can have one of the biggest benefits in your overall health. Okay. Engaging in new learning opportunities, whatever that might be. It could be painting. It could be other forms of arts and crafts. It could be trying to learn something new, like a new language, whatever, something that's challenging to your brain and cognition. Some challenging tasks that involve physical activity. All of it together has an overall benefit and contributes to, that thing called happiness, that dimension in our lives. And resilience too, and better overall health, which anything that benefits your overall health, I'm just going to put it bottom line, benefits the brain. Bottom line, anything that contributes to the benefit and betterment of your overall health will have a positive impact up here. So playing it safe as we age is more than just putting a helmet on when you get on a bicycle. Although I have to admit, when I get on a bicycle, I wear a hat, but it's not always the right kind of hat. Which means I'm taking a risk. If I get knocked over, I could get a brain injury. So, but at the same time, you could do yourself a lot of harm if you're engaging in maybe untried, unsupervised exercises that are likely to put you in danger. So that needs to be figured out between You know, for instance, here you come and engage in a variety of exercises and stretching and mild weights. Okay, so there's a benefit to all these things, but you know your own limitations throughout. That's the thing. You got to be self-aware. If you're not self-aware and say, yes, I can do this, I can jump off the roof, land on this thing, and bounce up and down. Well, anything that poses a big risk, you shouldn't be trying. That said, you should be trying out new experiences. And all this other slide is going over for you is the benefits of activity and maintaining activity as we age and trying new things as far as activities as we age. And this other slide here, though, in more of a, I don't know, what color is that, Ivan? Purple? No, that's not purple. Oh, it's a prune colored. So the prune colored diagram here just gives advice to a certain extent on how much exercise. What should I do? Should I engage in yoga, maybe weights, maybe some other things that also will work your muscles out. So playing it safe means mixing it up. All right. Do different things that'll challenge your body and your brain, both. Oh my goodness. They could be puzzles like we do here. They could be word games, mathematic games like we have here. We have the puzzles with the math department coming in and challenging us with games that really task the brain and the mind to figure out how to solve that puzzle of a different kind. So whatever it is, though, come prepared. Again, I reiterate, use thought, know yourself and your limitations when you decide to do something new. So just to recap really briefly, it's a multifaceted effort for a healthy brain. As we, our brain ages just like our bodies age. It's kind of like, well, we do the best we can to keep our body as youthful as possible. So many ways that some of them I described here, and those will benefit the brain in keeping, normal function, proper function a lot longer. Overall health benefits the brain, in other words. Prevention is the best medicine when it comes to maintenance, whether it's the body or the brain. Knowing what to engage in, what you shouldn't, knowing what to try, shouldn't try, knowing what foods or substances to put into the body and which ones to avoid. So that goes along with developing healthy habits. And it's never too late to engage yourself and learn, no matter how old you are. We played a video for our students downstairs. We started doing this, every semester. And in one caption or one story, there's a 90-year-old gentleman interviewed, and he's learning to paint and do other things at 90. And just to try to challenge himself and keep his brain working, engaged. And so I would say if a 90-year-old can do it, so can we at any age. If a 90-year-old can do this kind of thing, we should start doing it earlier and keep it going as a thing. So in conclusion, you have any questions? No? Any issues, concerns about the brain and cognition? Any questions about, how to optimize things? Because like I said, if you're keeping the rest of your body healthy, your brain is going to benefit from that. And of course, I didn't talk about mindfulness, but that also is a big contributor to brain health. Going back to depression, anxiety, My gosh, you mentioned this yesterday. I forgot your name.
Cody,
Dodie. Dodie, we were talking about this yesterday about a treatment called transcranial TMS, transcranial magnetic stimulation. And it's something my wife also had to actively, treat her depression. And that was one treatment. I didn't decide to include it in this talk because I wasn't necessarily going over, medical treatments, but that was one I hadn't thought of. But, and, as a desired and a good treatment for, chronic depression, maybe. But that's one that doesn't require you take a pill or undergo some sort of some sort of invasive procedure. Anyway, I thought I'd add that in there because we talked about that at great length the other day, Dodie. So that was a good suggestion. Something I think I need to add when I talk about depression and mood disorders. I can get around to doing a session on that and include TMS in that as a treatment. It's viable. It works for some people. Well, it is hooking you up. You go into an office where they have you sit in a chair. It reminded me a little bit of monitoring somebody for epilepsy, wires and leads, but they use magnets to help treat. Yes, yes, thank you very much. Which brings electrical current. And I guess it's processed through the surface of the skull and to the brain. And apparently it disrupts, I want to say, certain electrical processes or maybe even chemical processes that depends on where the depression's coming from, though. So, but forces and processes that contribute to your depressive disorder. Now, imagine it doesn't treat, it's not a fix-all for all mood disorders, but for certain ones, it's beneficial. And usually doesn't cause a lot of discomfort. It doesn't. So, when we think about things that are planted on the head, we think about, oh God, is this pig gonna?
No, you feel it?
no, Bill, they have a little bit pepper on top of it.
Oh, so
They
it's
know
like,
exactly.
It's stimulating.
so 10 machine lights?
Almost. That's what I kind of liken it to. That's a good, yeah, a lot more leads.
No leads.
Or what is it? What is it that's, it's like a cap though, that,
They put a cap on you when they, after they've done the measurements. So that on that cap, they know exactly where to put them.
okay, so,
Right, I can explain it.
yeah,
I've done a lot of research on this.
okay, so, Ivan wants to contribute to this. Go ahead.
Sure, so basically, if anybody has a background in engineering or kind of physics, anything that has an electrical current in it, so that's electricity traveling through it, so that's amperage, automatically induces a magnetic field. So the rule is your right hand rule. So basically, like this, if you curl your hand to a fist, if the electricity's going this way inside of a wire, it means the electrical current is going in this direction. What's interesting is that not only does this happen when does an electrical current induce a magnetic field can induce an electrical current. This is how phones wirelessly charge. Basically, they charge up a magnetic field, and because there's a magnetic field it forces electricity to start running. Same thing here. It happens when the cause of depression or mental illness is physiological. It's not always the case. So there's a picture here that I'll pull up.
Oh, thanks, Ivan. Go ahead and can you kick me out?
Sure. Well, it's okay.
Or do you have that included?
Basically, it's like this. See how the brain on the left side, how it doesn't have a lot of electrical activity. That means if the person's experiencing a lot of problems mentally, it might be because their brain is not being active in a lot of regions, and especially if it's not active for a long period of time. And so what happens is kind of where what happens sometimes, same thing with the heart, sometimes it just needs to be jump started. And when you induce this, basically, sometimes the reason they do the head measurement is because they need to aim it. So, and when they aim the
That
magnetic
makes
field,
sense.
it forces electrical currents to start flowing in that part of the brain. And often what happens is that it gets things going again. Once those pathways are used again, your brain starts using them more and more. So same thing with our memory. If we don't try to, memorize stuff, we're not going to remember them because those pathways are not used. Kind of like that. Pretty
Exactly.
cool.
Well, when you think about it, our brain is made up of neurons and and brain cells. They are electrical. They have a certain, they'll fire if they reach a certain generate an action potential, and that's electric. So it makes sense that you can operate pointing an electrical field or an electrical, I want to say, what is it, charge, or creating an electrical field, pointing it and aiming at something might actually
Jumpstart it.
jumpstart that area, and that area will become more active now.
Mhm.
Yeah, that's a good point. That's a very good point.
Cost much? Go under that?
I think if
Very much involved.
insurance based, I think that's how my wife got it. Yeah, insurance.
Thirty would you suggest? You encourage people to do this?
And it's cool because it's not literally shocking your brain.
Oh, yeah, I think of Frankenstein. No, we could talk about seizures, because that's a short circuit of electrical problems in the brain. Oh,
Oh, okay,
I'll tap on your head and tell you what it feels like.
okay.
Susan has a question.
Just go back to, this is ancient history, but One Flew Over the Cuckoo's Nest.
Oh, that was a great movie.
I had the opportunity to work in Stockton State Hospital for the mentally ill. I worked on an acute geriatric ward, they called it. And we had a doctor from UC Davis who would come out and perform electroshock therapy.
Yeah.
Which I got to observe. What he did was provide muscle relaxants to the point that the person had to be on a ventilator, so to speak.
Intubated, yeah.
And so then they were able to do the electroshock without, I mean, the nose would twitch, that was it. But, and of course, the purpose was to cause that would cause an amnesia, through which then, as you were supervised in recovering from the amnesia,
Yeah.
you would be able to work out without having to, all the anxiety and depression.
Kind of like a reset
Wow.
of
Yeah.
sort.
Yeah, we had a patient who she would just sit and wash and wring her hands all day, 24/7.
Yeah.
And I had the opportunity to observe that. But-
Well, it's funny you bring that up.
Oh, yeah, she calmed right down.
My oldest brother was in a state hospital in and out for several years. He was schizophrenic, manic depressive. He had a lot of problems with mood stabilization. Well, he got electroshock therapy on a fairly regular basis too.
Did it help?
Well, you know what? It made him more approachable, less paranoid. Because his schizophrenia was the paranoid type. And so it made him more approachable. Didn't help his other habits, which were
Okay.
but yeah, One Flew Over the Cuckoo's Nest, that's a classic film. Yeah. Interesting. Thanks for bringing that one up.
And it didn't necessarily give us a positive,
Yeah.
No, but,
Remember that.
you know,
but sure brought the, issue to,
it taught us as nurses what not to be.
there you go.
We don't want to be Nurse Ratched. Nurse Ratched, yes. And I think that gal got an Academy Award for her performance. Yeah, wow. But yeah, gosh. God, I need to do something about, something about depression, treatments for depression, treatments for depression, and certain other mood issues that I can help bring to light, maybe.
Bringing one of the machines. Yeah,
I'd have to break into, yeah, well, the TMS is, it's been around for a little while, but not, 50 years,
It's
of
like the
course.
extend machine, and it's zapping.
Well, I'll tell you, TENS machine, that gets rather bothersome. Given that pulse of,
Right,
it's like, oh, I'm gonna have to pull that off.
yeah.
So, because I used to wear one. Yeah. So yeah, very cool. Well, any other questions or concerns at this point, or anything else you want to talk about in regards to brain health, overall health, et cetera? Oh, thanks. Thank you very much. Okay, so this meeting is officially ended then, or unless there's somebody out there in Zoom land.
This is Fox.
Oh, just the Fox, okay. No questions from Mr. Fox or Mrs. Fox? Or a Fox? Okay,
What did you work out today, David? Yeah.
well, let's call it quits to this session then.
Yeah.
Right.